Teresa and Kevin did everything right. They both worked. They both saved. They had health insurance through Kevin's employer, a mid-sized manufacturing company in Columbus, Ohio. They had a joint savings account with $19,000 in it. That took them 7 years to build. 7 years of packed lunches. 7 years of skipped vacations. 7 years of saying not yet when their kids asked for things they wanted. $19,000. On a Tuesday in March, Kevin had a heart attack. He was 44 years old. He was in the middle of a morning meeting. His coworker called 911. The ambulance came in 8 minutes. The paramedics stabilized him. The hospital did everything right. Kevin survived. 3 days in the cardiac intensive care unit. 1 stent procedure. 1 night in a step-down unit. 4 prescriptions. 1 follow-up cardiology appointment scheduled before discharge. 6 weeks later, the bills started arriving. The ambulance, $2,400. Insurance covered $900. Teresa owed $1,500. The emergency room, $4,200. Insurance paid $2,100. Teresa owed $2,100. The cardiologist who performed the stent, $11,000. Insurance covered $6,800. Teresa owed $4,200. The hospital facility fee, separate from the doctor, $8,900. Insurance paid $4,500. Teresa owed $4,400. The anesthesiologist, who Teresa never met, never chose, never knew was in the room, sent a bill for $3,600. He was out of network. Insurance paid nothing. Teresa owed $3,600. Total billed $30,100. Total insurance paid $14,300. Total Teresa owed $15,800. $15,800. In 6 weeks, 7 years of savings became $3,200. Kevin was alive. Kevin was recovering. Kevin was going back to work. And Teresa was sitting at the kitchen table at 2 a.m, staring at a stack of bills, doing math that did not add up no matter how many times she ran it. This is not a rare story. According to the Kaiser Family Foundation, 62% of American adults say they worry about being able to afford unexpected medical costs. Not 62% of poor Americans. 62% of all American adults, including the ones with insurance, including the ones who save, including the ones who did everything right. The United States spends more on healthcare per person than any other wealthy nation on earth. And yet, a single hospitalization, even with insurance, can erase years of disciplined saving in a matter of weeks. According to the Consumer Financial Protection Bureau, medical debt is the #1 cause of personal bankruptcy in the United States. More than job loss, more than divorce, more than any other single financial event. And here is what makes it different from every other kind of debt. You do not choose it. You do not sign a loan agreement. You do not decide to borrow. You are unconscious on a table, and someone you never selected, someone you never agreed to pay, walks into your room and does their job, and then sends you a bill that your insurance does not cover. Teresa's anesthesiologist was out of network. She did not know that. She did not have a choice in the matter. She was not in a position to shop around. Kevin's heart was stopping. This is called a surprise medical bill. And according to the Commonwealth Fund, 1 in 5 Americans who have insurance report receiving a surprise out-of-network bill after receiving care at an in-network facility. 1 in 5. With insurance. Now I want to be honest with you about something. The No Surprises Act, passed in 2022, provides some protection against certain surprise bills. If you are taken to an emergency room at an in-network hospital, the Act limits what out-of-network providers at that hospital can charge you. This is real progress. Teresa's situation today might be slightly different in some states than it was before the law. But the law has exceptions. It does not cover ground ambulance services, which are still almost entirely unregulated. It does not protect you from high deductibles, high coinsurance, or out-of-pocket maximums that reset every January. It does not prevent bills from arriving. And it does not change the fact that according to the Federal Reserve SHED, the Survey of Household Economics and Decision-Making, 40% of American adults say they could not cover an unexpected $400 expense without borrowing or selling something. $400. Kevin's ambulance ride alone was $2,400. Most people watching this right now have health insurance and still have no idea what their out-of-pocket maximum is. If that is you, share this video with one person you care about. Not because it is interesting. Because it is urgent. And if this channel has ever given you something useful, hitting that like button takes 2 seconds and it helps more people find this before they need it. Teresa had savings. Teresa had insurance. Teresa still lost $15,800 in 6 weeks. What happens to the family that does not have savings? According to the American Journal of Public Health, 66.5% of all personal bankruptcies in the United States involve medical debt as a contributing factor. And in the majority of those cases, the person who filed had health insurance at the time of the medical event. Insurance is not protection. Insurance is a partial payment system. And the part you pay, the deductible, the coinsurance, the out-of-pocket maximum, the out-of-network surprise, can be devastating. This is not a failure of individuals. It is a design. Here is what Teresa learned in the months after the bills arrived. And these are things I want you to know before you ever need them. The first thing she learned: every bill is negotiable. This is not widely known. Most Americans assume a medical bill is like a utility bill, fixed, non-negotiable, due by the date on the paper. It is not. Hospitals operate on a charge master, an internal list of maximum prices that almost nobody pays in full. Insurance companies negotiate down from those prices. And individual patients can negotiate too. Teresa called the hospital billing department. She asked for an itemized bill, a line-by-line breakdown of every charge. According to the American Hospital Association, patients have the legal right to request this. She found 3 billing errors totaling $940. She had them corrected. Then, she asked about their financial hardship program. Every nonprofit hospital in the United States is required by the heirs to offer financial assistance to qualifying patients. Many for-profit hospitals do too. Teresa qualified. Her hospital facility fee was reduced by 60%. That single phone call saved her $2,640. She did the same with the cardiologist's office. She asked to pay in cash. She offered to settle the full balance at a discount. The billing department accepted 65 cents on the dollar. She saved another $1,470. She could not do anything about the anesthesiologist at first. He was an independent contractor. He refused to negotiate. She filed a complaint with her state insurance commissioner. 3 months later, his billing company sent a revised statement reducing the bill by 40% under pressure from the regulatory review. She saved another $1,440. From $15,800, Teresa reduced her actual obligation to $9,320. She put it on a zero-interest medical payment plan, which many hospitals offer when you ask, and paid it off over 18 months. She did not lose all 7 years. She lost 4.5. Here is what I want you to do before any of this happens to you. First, understand your actual out-of-pocket maximum. Not your deductible, your out-of-pocket maximum. This is the most important number in your health insurance plan. According to the average out-of-pocket maximum for an individual on an employer plan in 2024 is $9,450. For a family plan, it can be nearly $20,000. That is the maximum you will owe in a single year, but you can owe that entire amount from a single hospitalization. That is your target for your medical emergency fund. Not your regular emergency fund, a separate account specifically for healthcare costs. According to Vanguard's How America Saves report, households with a dedicated health savings account experience 53% less financial disruption from medical events than those without one. The vehicle for this is an SA, a health savings account. If you have a high-deductible health plan, you are eligible. In 2024, individuals can contribute up to $4,150 per year. The minimum deductible to qualify is $1,600 for an individual plan. Families can contribute up to $8,300. That money goes in pre-tax, grows tax-free, and comes out tax-free for medical expenses. It is the only triple tax-advantaged account in the American financial system. According to EBRI, Americans who maximize their ISA contributions and invest the balance in index funds rather than holding it in cash retire with on average $46,000 more in accessible healthcare funds than those who do not use an ISA at all. Second, always request an itemized bill. Always. According to the CFPB, billing errors affect a significant portion of hospital bills. You have the right to see every charge, every code, every line item. Do not pay a summary bill. Ask for the breakdown. Check every item. Duplicate charges, incorrect diagnosis codes, charges for services not rendered, these are common enough that patient advocates make their living finding them. Third, ask about financial assistance before you set up a payment plan. Every nonprofit hospital must publish its financial assistance policy. Many people who qualify never apply because they do not know it exists. Income thresholds are often higher than patients expect. In some hospital systems, households earning up to 400% of the federal poverty level qualify for reduced or zero-cost care. Fourth, use a medical billing advocate if the bills are large. These are professionals, often registered nurses or former insurance company employees, who review bills for errors, negotiate on your behalf, and typically charge a percentage of what they save you. If they save you nothing, you pay nothing. According to the Medical Billing Advocates of America, the average billing error found per audit is $1,300. Teresa is 39 now. Kevin is 46. He takes 2 medications every morning. He walks 3 miles every day. He is healthy. Their savings account is back to $11,000. It took them 3 years to rebuild. It will take another 2 to get back to where they were on that Tuesday morning in March. 5 years to recover from 3 days in a hospital. And they were the lucky ones. Kevin is alive. Teresa knew how to fight. The system gave them something to fight against rather than nothing at all. Most families do not know that bills are negotiable. Most families do not know about financial hardship programs. Most families do not know they can request itemized statements or file complaints with state insurance commissioners. They just pay. Or they do not pay, and the debt goes to collections. According to the CFPB, medical debt is the most common item on American credit reports. And medical debt in collections can drop a credit score by up to 100 points, affecting your ability to rent an apartment, buy a car, or get a mortgage. Kevin's heart attack was not preventable. The financial destruction that followed it was, not entirely, not perfectly, but significantly. The difference between Teresa losing $15,800 and $9,300 was 5 phone calls. 5 phone calls that took a total of 4 hours. 4 hours. $6,480 saved. That is $1,620 an hour. There is no job in America that pays you that. Know your out-of-pocket maximum. Build your SAW. Request itemized bills. Ask about financial hardship programs. And know, before you ever need it, that the number on the bill is not always the number you have to pay. Kevin had a heart attack on a Tuesday. It almost took his life. It almost took their life savings too. You cannot always stop the first one. But now you know how to survive the second. If this video helped you, or if you know someone who is dealing with medical bills right now, please share it. Most people fight these bills alone because nobody told them they could fight at all. You now know that you can. Subscribe if you want to keep learning things like this, and I will see you in the next one.